College of Medicine, and I will be assessing you today. Before we get started, is there any visual or hearing impairments that will affect our examination today? Okay. Can you state your full name and birthday for me, please? Very good. Today I will be assessing your nose and sinuses. I will be looking and feeling the outside of your nose, as well as gently looking at the inside of your nose. Is that okay with you? Everything done here will remain confidential. Only the healthcare team and I that are attending to your care will know of the results of this examination. Is that okay with you? Okay. Now let me start by asking you some simple questions. Do you have any allergies, ma'am? Are you having any difficulty breathing through your nose? Are you experiencing sinus infections at the moment? Have you recently had any injuries to your nose or face? Any nosebleeds? Are you taking any medications right now? And are you experiencing any changes to your sense of smell? Okay. Now I will start my physical examination. Make sure to observe the proper infection control prior to meeting with the patient. You can do this by triage and by the screening process, washing and sanitizing your hands, and wearing your proper PPE. Make sure to also gather and sanitize all the materials and equipment that you will need. There should be good lighting for this assessment, and then after establishing your rapport, you need to obtain a complete and thorough history.
Anterior view is used to assess the symmetry of the nose and midline structures. Sometimes the line of the light in the front of the nose can be used clinically to detect any deviation. Lateral view looks at the dorsum of the nose, tip, and the angle that is made by the columella and upper lip. For males, it occurs at around 90 degrees, while females at 110 degrees. Inferior view can be done by asking the patient to lift their head up slightly to be able to observe the columella and symmetry of the nostrils.
After inspecting, I see that the color of the nose matches with your face, and I see no inflammation or any sensitive skin lesions or deformities, and also that the nasal structures are also symmetrical. Now we will go on to the next examination.
So the next part of the examination will be the palpation of the sinuses and the dorsum of the nose. So what I'm basically going to do is I'm going to touch areas of the nose, specifically the sinuses and the dorsum. All you have to do is inform me if there is any presence of pain when I touch those areas. So may I start with the examination?
Yes.
Firstly, I'm going to touch the dorsum of the nose. So, is there any pain? Okay. So next, I'm going to touch the frontal and maxillary sinuses. Inform me if there is pain. Okay. Is there any pain? Okay. So how about this one? Is there any pain? Okay, so upon examination, there was no tenderness nor pain in the dorsum and the sinuses of the nose.
Now we are going to check your functions of your nose. First we are going to do the test for the sensation of the nose. Can you identify the smells which I am showing? Now we are on the performance practice. I will ask you to make an exhale and we see the moisture. This is indicated that there is some kind of water inside. So we will try it. Okay. Now we are going to do the performance practice to check for the moments of the nose. Okay. Okay, so the examination of your organs are complete and you evaluate.
Angiorhinoscopy is an examination of the nasal cavities, enabling to know the nasal secretion, swelling of the terminates, properties of the mucosal surface, position of the nasal septum, ulcerations or presence of foreign bodies. It is done using the nasal speculum along with the light source to visualize the anterior third of the nasal cavity. So this is the technique. Hold the nasal speculum with the non-dominant hand with the index finger pressing on the ala of the nose to anchor the upper blade of the speculum in place. Insert the nasal speculum in an upward and backward direction 1 cm into the nasal vestibule and its blades closed. The point of speculum is directed slightly laterally in the vestibule. Open the speculum blades vertically within the nasal vestibule. Examine the roof, floor, lateral and medial walls of the nasal cavity systematically. Hold the nasal speculum slightly open when removing it to prevent pain due to avulsion of vibrissae. Use the dominant hand firmly on the top of the patient's head to change the head position from time to time.
This is the examination for posterior endoscopy. In this procedure, we examine and look for the postnasal space. For this, ask your patient to be comfortable and open the mouth. Wide open. Use your mirror and tongue depressor. The mirror is first warm and then introduced in the oral cavity and along with the tongue depressor. While we are doing that, we examine the parts such as the posterior end of the nasal septum, the turbinates, the opening of esophageal tube, and also the soft palate. And this is done to look for the findings if there is any change in the shape, size, or if there is any blockage, or if there is any filling of the pus in the sphenoid mark area. And just visualize all the organs as much as possible in.
So that concludes the assessment of the nose and sinuses for today. As of now, I have not found any abnormal findings. However, if you have experienced any problems in the future, you may always come back. So do you have any questions? So thank you.